So hello students, today we will be covering the part 2 of papillosquamous disorders. We will be discussing lichen planus and we will be discussing pityriasis rubra pilaris, right? So let's start by discussing lichen planus. Now lichen planus is a mucocutaneous autoimmune disorder right. Now the antigen in lichen planus is unknown. Okay, what is triggering this particular condition? We do not know the antigen exactly here. It could be a self peptide, that could act as an antigen. Okay, or it could be some external agent, like it could be infection, like HCV, or it could be drugs. Something amongst these is triggering a T cell response, and that is leading to interface dermatitis picture, right? What is interface dermatitis? We will come to that. Before that, let's look at drugs that can lead to lichen planus or lichen planus like eruption. What are they? So the one you have to remember is hydroxychloroquine. Another is ACE inhibitors. Then you have dental amalgams, which contain mercury, and gold salts, heavy metals like gold salts, right? You could be having a patient who has undergone a dental procedure and has development of a rash which is violaceous and has features of lichen planus. So then you have to think about lichen planus then. So lichen planus is a mucocutaneous immune disorder in which the antigen is unknown to us. It could be something in the body, it could be a self-peptide that could be triggering this reaction, or it could be an external agent. There has been a controversial association with hepatitis virus, or it could be drugs like hydroxychloroquine, ACE inhibitors, gold salts, dental amalgams which have mercury, that could be triggering a lichen planus like reaction. So that generates a T cell response and it leads to interface dermatitis. Now what is interface dermatitis? Interface dermatitis has three features. Okay, there is a band like infiltration of lymphocytes and inflammatory cells hugging the dermoepidermal junction. Just have a look here. This is the stratum corneum, this is the granular cell layer, this is the spinosum, this is the dermoepidermal junction, right? Right. So just have a look. This is a band, this purple collection that you see, this is a band of infiltrate. It's very hugging, it's present at the dermoepidermal junction, almost like it's hugging the dermoepidermal junction. So this is a very classic feature of interface dermatitis that we see in lichen planus. Then there is apoptosis of the basal keratinocytes. What are these apoptotic bodies in lichen planus called? They are called as cavate bodies, okay. And there is degeneration of the basal cell layer. So basically this band like infiltration that is hugging the dermoepidermal junction, it's causing degeneration of the basal cell layer and apoptosis of the keratinocytes of the basal cell layer. So interface dermatitis is a broad term. It's a histopathological picture where you get these three findings. So it's found in lichen planus. Apart from that, interface dermatitis is also found in drug rashes. Okay, you get it in drug rashes. You get it in erythema multiforme, FDs. You also get interface dermatitis in drug rash.